Hey, what's up? So, this video is a quick recap of SMAS, which is a very important maxillofacial surgery topic relevant to cosmetic facial surgery and other kinds of aesthetic surgical practice related to the face. So, from the name, the SMAS, the full form of SMAS, it is basically your superficial muscular aponeurotic layer. So, as the name suggests, it is a layer, it's a fibrous layer which is present above the muscle. So, superficial muscular above the muscle, so it's superficial muscular aponeurotic layer. So, why SMAS is so relevant? And where is it located? If we start dissecting the face, so first of all, we will get the skin, which is made up of your two layers, epidermis, dermis. Hypodermis is beneath your dermis, which is also called as your subcutaneous layer, where we have the superficial fat pads. So we have your skin, we have your subcutaneous layer, and beneath the subcutaneous layer, we have the SMAS. And beneath the SMAS, we will have your deep fat pad layers. Beneath the deep fat pad layers, we have the facial muscles. Beneath the facial muscles, we have your periosteum. And beneath the periosteum is your bone. So the SMAS is somewhat located in between your superficial fat pad layer, or also known as your subcutaneous layer, and beneath the and above the this thing deep fat pad. So whenever we are doing any kind of cosmetic treatment which is related to facial tightening, we have to target the SMAS. Why SMAS? Because mass is the the thing that is causing your face to sag down. If the SMAS is loose, all your facial fat compartments will generally come down because of the action of gravity. So the treatments are done to target the SMAS layer. Now, the SMAS layer can be treated by some surgical modalities and some non surgical modalities. Amongst all these modalities, the facelift surgery, which is a kind of surgical treatment option for SMAS, is the gold standard. The kind of result that you will get with facelift surgery is not at all comparable with what you will get with the non-surgical treatments. Okay, so whenever we are doing any kind of treatment to tighten up the SMAS, be very sure to counsel your patient that facelift is the ultimate solution for severe sagging. If there is mild to moderate sagging, somewhat you can manage with non-surgical options. Now, coming to the non-surgical options, what are the different kinds of treatment options you have? So the number one is HIFU. It's a kind of energy-based device option where we target the SMAS layer. It just contracts and tightens up the SMAS layer. It has nothing to do with proper lift. It's a very temporary procedure, and the result can last for a few months only. If you are doing a thread lift procedure, which is another kind of non-surgical treatment for SMAS tightening, it can last for around 2 years. Now, the thread can be either your PDO thread or a PCLA thread. Generally, we use a cork kind of thread, which can be either made up of PDO or PCLA, polyl lactic acid, or polydiaxanone. So these two are kinds of surgical sutures which are inserted beneath the skin, at which layer? Above the SMAS or at the level of SMAS. So these two layers are targeted and will lift the face, and it is also a very subtle lift, not something dramatic facelift you will get. The result can last somewhat one and a half to 2 years. And whenever we are doing facelift using non-surgical treatment modality, we always target the SMAS layer or the layer above the SMAS. Like I said, if you are doing a HIFU treatment, HIFU treatment generally targets your dermal layer, or it can target your SMAS layer also. And if you are doing a thread lift, we generally place the cork threads at the level of SMAS or just above the above the level of SMAS. If you're doing a proper PCLA thread lift, which is very thicker and lasts very long for around 2 years, we generally place it at the level of SMAS. Otherwise, you can feel the barbs of the thread if you move your fingers at the cheek. So try to place it a little deeper, but don't go beneath the SMAS, because if you go beneath the SMAS, there is high chance of injuring the facial nerve, which lies just beneath it. So always try to stay above the level of SMAS. Now, coming to the surgical modalities, facelift is the only gold standard treatment option available to truly lift the face. We do SMAS plication, that is, we actually lift the SMAS using instruments and we tighten it up and we stitch the SMAS at a higher level. But none of the non surgical treatment actually does that. So, it needs a lot of expertise to do non surgical, to do the surgical facelift, and it requires proper anatomical knowledge, a surgical background to do that. And if you're doing deep facelift, then obviously you need to have some advanced kind of surgical training to do that. And the results are actually worth like praising. The results of actual facelift surgery is worth praising. If you see the pictures of the facelift on various social media platforms, you will be amazed to see how beautiful the results are. But yes, obviously, whenever you are doing any kind of surgery, it has some kind of downtime. You cannot like say that, yes, I don't want any kind of downtime. I just want the result. That's never possible. So just counsel your patient properly. See whether the patient is medically fit or not, because that's the only criteria you need to know. Because if your patient is not medically fit, obviously there is no point of doing that kind of facelift surgery. And if there is if you do not want any kind of downtime, you can go ahead with non-surgical therapies. Now we have another kind of non-surgical therapy which is very common these days in most of the clinics. It is radio frequency treatment. So this radio frequency treatment also lifts a little bit of the SMAS, but no dramatic effect will be there. You require a lot of sessions, at least 10 to 15 sessions will be required to get a subtle lift, and it generates heat also. So if your patient is having pigmentation issue, melasma, or any kind of stubborn pigmentation, there can be rebound hyperpigmentation because of the heat coming out from the radio frequency. But otherwise, if the patient is ready to go, any kind of this thing, non-surgical, low cost non-surgical face tightening procedure, then radio frequency can be chosen. And if I compare radio frequency with HIFU, then HIFU will be the preferred option. Now coming to the thread lift, it is far more better compared to HIFU and your radio frequency treatment. But thread lift has a little bit of downtime. There can be swelling, there can be pain, there can be ecchymosis, bruising problem is very common with thread lift. Also, there can be damage to the facial nerve if not done properly. Also, to undergo thread lift, your patient should be medically fit. And for undergoing any kind of energy based device like HIFU or radio frequency, your patient should have a good heart, cardiovascular health should be good. There should be no pacemaker present in the patient's body. So be make very sure that patient does not have any kind of arrhythmia or does not have this pacemaker. For non-surgical thread lift, for thread lifting with PCLA or PDO threads, there should be no cardiovascular disease, like patient should not take aspirin or blood thinners, because these can induce bleeding. Also, diabetes, if the patient has diabetes, then proper antibiotic coverage is mandatory, because it's a kind of minimally invasive treatment. It involves a cut, it involves bleeding, it causes bruising. So proper medical evaluation is very crucial. And if you are planning for non-surgical and if you are planning for surgical facelift, then definitely proper diagnosis, proper medical history, surgical fitness, everything is required for any kind of surgical cosmetic procedures. And of course, proper training, proper knowledge of the anatomy, and proper medical setup, proper anesthesia, proper OT setup, everything is needed to undergo a surgical facelift. And these are the current options we have to lift the face. And these all fall under the modality of your facial rejuvenation and facelifting therapies. So I hope this video is helpful for the budding surgeons and the budding cosmetic physicians, whoever is practicing aesthetics, and subscribe the channel for more such content. Bye bye.